Filled square clinical skills. History. Taking the recorded history of an illness should include all the facts of medical significance in the life of the patient. Recent events should be given the most attention. Patients should, at some early point, have the opportunity to tell their own story of the illness without frequent interruption and, when appropriate, should receive expressions of interest, encouragement, and empathy from the physician. Any event related by a patient, however trivial or seemingly irrelevant, may provide the key to solving the medical problem. A methodical review of symptoms is important to elicit features of an underlying disease that might not be mentioned in the patient's narrative. In general, patients who feel comfortable with the physician will offer more complete information. Thus, putting the patient at ease contributes substantially to obtaining an adequate history. An informative history is more than eliciting an orderly listing of symptoms. By listening to patients and noting the ways in which they describe their symptoms, physicians can gain valuable insight. Inflections of voice, facial expression, gestures, and attitude, i.e., body language, may offer important clues to patients' perception of and reaction to their symptoms. Because patients vary considerably in their medical sophistication and ability to recall facts, the reported medical history should be corroborated whenever possible. The social history also can provide important insights into the types of diseases that should be considered and can identify practical considerations for subsequent management. The family history not only identifies rare genetic disorders or common exposures, but often reveals risk factors for common disorders, such as coronary heart disease, hypertension, autoimmunity, and asthma. A thorough family history may require input from multiple relatives to ensure completeness and accuracy. An experienced clinician can usually formulate a relevant differential diagnosis from the history alone, using the physical examination and diagnostic tests to narrow the list or reveal unexpected findings that lead to more focused inquiry. The very act of eliciting the history provides the physician with an opportunity to establish or enhance a unique bond that can form the basis for a good patient-physician relationship. This process helps the physician develop an appreciation of the patient's view of the illness, the patient's expectations of the physician and the healthcare system, and the financial and social implications of the illness for the patient. Although current healthcare settings may impose time constraints on patient visits, it is important not to rush the encounter. A hurried approach may lead patients to believe that what they are relating is not of importance to the physician, and, as a result, they may withhold relevant information. The confidentiality of the patient-physician relationship cannot be